How much pain will I be in after bariatric surgery? This is a very common patient question, and we're going to talk about it today, and a few simple things to make it more tolerable. My name is Grace, and I'm a physician assistant that's worked with bariatric surgery patients for the last 20 years. Quick disclaimer first. Today's video is general education only. This is not meant to replace your bariatric surgery team or to be taken as personalized medical advice. That said, over the years of treating bariatric surgery patients, I've learned there are commonly accepted and simple things that can help patients feel a lot more comfortable during the recovery period. Common sources of discomfort can include incision soreness, stiffness from how your body was positioned during surgery, shoulder discomfort from laparoscopic gas, and general soreness from getting up and moving around after a procedure. Typically, patients will tell me it feels like they did 100 sit-ups the day before, so similar discomfort to overdoing a workout. Now let's get started on some things that may help you. Number one, position changes. One of the simplest things that can help is changing positions. Sometimes patients find that one position feels okay, and then they stay there for hours. But staying in one position too long can make you feel more stiff. It can also put pressure on incision sites. Just make sure you do not twist aggressively, and of course you don't want to do anything that's going to strain yourself. And definitely don't do anything your surgeon told you not to do. But gentle position changes can make a big difference. Some bariatric programs will prescribe pain medication for a short period of time after surgery to take as needed. Some don't, and instead allow over-the-counter medications like Tylenol. As with any other medication, do not take more than recommended or mix with other medications unless it's clear to do so by your bariatric team. And don't forget, for the first 6 weeks after bariatric surgery, most programs recommend that all medication be either liquid, chewable form, or solid pills that are able to be crushed and mixed with liquid before swallowing. For most bariatric patients, it's also usually not advised to take medications that are in the NSAID class, also known as non-steroidal anti-inflammatory medications. These include ibuprofen, Motrin, Advil, Aleve, naproxen, aspirin, and other NSAIDs. So be sure to ask your bariatric surgery team what your pain control options are before surgery. You don't want to be home in pain and guessing. Another thing that may help with some patients is gentle warmth. A warm pack can sometimes help with soreness, stiffness, and other discomfort. But be careful. Do not put heat directly over your surgical incisions unless your bariatric team says it's okay. So use a barrier. Keep it gently warm, not hot, and use it for short periods. Most programs recommend no longer than 10 minutes at a time. And remember, after surgery, some areas near incisions can feel numb or have altered sensation, so it can be easier to burn yourself without realizing it. Be careful and check your skin frequently. If I had to pick one of the most important things after surgery, it would be gentle walking. Not trying to hit a step goal, not pushing yourself until you're sweating and your heart is racing. I mean short, frequent, gentle walks. Walking can help move intestinal gas. It helps reduce stiffness. It can help lower the risk of blood clots, and it helps you take deeper breaths and recover more smoothly. For many patients, frequent short walks are better than one long walk. So instead of thinking, I have to go walk for 30 minutes, think, can I get up and just move around the room or walk down the hall and back for just a few minutes? Rest, then do it again later. Of course, always follow your bariatric team's activity recommendations. Another common issue is gas discomfort. This can be abdominal bloating, pressure, or sometimes shoulder pain from the gas used during laparoscopic surgery. Some patients are told they can use over-the-counter medications such as chewable Gas-X to help with gas discomfort. But again, clear this with your bariatric team first. One more thing. Please do not try to be a hero. Some patients think they're doing good by waiting until the pain is really bad before taking anything or asking for help. But once pain gets out of control, it can be harder to bring back down and may require more medication. And if pain keeps you from walking, taking deep breaths, sipping fluids, or sleeping, that can interfere with recovery. So follow the pain plan your team gives you. A rule of thumb I always tell my patients is, I would rather you call or come to the hospital for an evaluation and it turns out to be something minor than you waited on something serious that is now worse than it could have been. So when in doubt, reach out to your team. If you like this content or you're trying to figure out what life after bariatric surgery is actually like, that's exactly what I help people with on this channel. So subscribe for more bariatric surgery and post-op recovery education. I release 3 videos a week. Thanks for watching, and I'll see you in the next video.